Hi, my name is Catalina Davalos, and today I'm going to be talking about cervical traction. The patient presents with palpable tightness and pain in the posterior deep cervical extensor musculature. Patient has limited active range of motion for cervical flexion and decreased strength for cervical extension. The diagnosis is muscle spasm of the deep cervical extensors. Benefit of spinal traction is that it facilitates relaxation of the paraspinal muscles from pain reduction caused by gating of the pain transmission by stimulation of the mechanoreceptors from oscillatory movement produced by intermittent traction, which causes interruption of pain-spasm-pain cycle. Some of the expected outcomes are to increase active range of motion for cervical flexion, to increase strength for cervical extension, and to decrease pain and tenderness in the posterior musculature. Some of the contraindications are if motion is contraindicated, acute injury and inflammation within the last 74 hours, joint hypermobility or instability, peripheralization of symptoms, and uncontrolled hypertension. And the precautions are structural disease or conditions affecting the bones of the spine, when pressure from the belt may be hazardous, displacement of annular fragment, medial disc protrusion, when severe pain resolves fully with traction, claustrophobia, inability to tolerate prone or supine position, disorientation, TMJ problems, and dentures. The parameters for muscle relaxation are going to be 11 to 15 pounds of force, 5-second hold and 5-second relax time, 20 to 30 minute total treatment time. Also, I'm going to check for precautions and contraindications before I start treatment, and I'm also going to let the patient know what they're going to be feeling throughout the treatment. Patient's going to be positioned supine with slight cervical flexion, and it's going to have a bolster underneath their knees for comfort. Once my patient is set up properly, I'm going to make sure that their occiput is going to be on the pads, and I'm going to tighten the pads until she feels comfortable but snug, and then I'm going to put the forehead strap tight enough to keep her head neutral. To attach the halter to the machine, I'm going to press rope release and hold it. Once I have enough slack, I'm going to attach it to the hook. And once that's done, I'm going to press hook release to remove the slack. For muscle spasm, we're going to have a hold of 5 seconds and a relaxed time of 5 seconds. The force is going to be a max of 15 pounds, and then the relaxed force is going to be 7 pounds, and the total treatment time is going to be 20 minutes. Once my patient is positioned properly, I'm going to also make sure that the table, since it's a split table, that it's locked. I'm going to give my patient a call button just in case they feel discomfort anytime throughout the treatment, and then I'm ready to start the treatment. Once I start the treatment, I also want to check on the patient every few minutes just to make sure that they're doing okay.